The newly enacted Social Health Insurance Act. The petitioner argues that the mandatory 2.75% from the employees is excessive for Kenyans who are already burdened with taxes and deductions. This comes as President William Ruto officially launches the Universal Health Coverage Plan, whose implementation will, of course, be streamlined by 4 new health laws, including the Social Health Insurance Act, the Primary Healthcare Act, the Digital Health and Facility Improvement Act, Financing Act, I beg your pardon, which were signed into law on Thursday of this week. Take a look at this story.
The over 18-year journey towards the implementation of the UHC rollout in the country has been frustrated by a myriad of challenges, the last attempt being the 2018 launch of the UHC pilot program in the counties of Isiolo, Nyeri, Machakos and Kisumu.
Wapi makofi ya rais?
On Friday, during this year's Mashujaa Day celebrations in Kericho County, President William Ruto launched the UHC plan in what seems to be the 4th attempt to jump-kick the initiative.
There have been several attempts and efforts to achieve universal health coverage. One in 2003, in 2013, and in 2018. However, these efforts were met with little success.
The launch comes just a day after President William Ruto signed the Social Health Insurance Act, the Primary Healthcare Act, Digital Health and Facility Improvement Financing Act into law to support the overhaul, which might improve health service delivery in Kenya. Under the Social Health Insurance Act of 2023, all Kenyans will be expected to enroll on a medical health scheme dubbed the Social Health Authority, which shall replace the National Health Insurance Fund with 3 funds, including the Social Health Insurance Fund, Primary Healthcare Fund, and the Emergency Chronic and Critical Illness Fund. The mode of contribution towards the health insurance will also change from the current flat rate of 500 Kenya shillings to the 2.75% of salary, which will see low-income earners contribute a minimum of 300 Kenya shillings and the high economic class contributing a maximum of 5,000 Kenya shillings.
Health insurance coverage in Kenya is generally low at about 26%. with those at the bottom of the economic pyramid having the least coverage at only 5%.
Under the Primary Healthcare Act, both the national and county governments are set to disburse 3 billion Kenya shillings every year to cater for their monthly stipend for the 100,000 community health promoters who will play a critical role in attaining UHC by offering health services at household levels.
The work of the promoters will include basic preventive and promotive health, health education, basic first aid for the treatment of minor injuries and ailments at household level.
The lack of autonomy in financing and the management of public health facilities in the country has led to poor service delivery and lack of transparency and accountability in the facilities. The government seeks to solve this through the implementation of the Facility Improvement Financing Act. The Digital Health Act has been identified as one of the key pillars in UHC. For now, Kenyans are waiting to see if they will be able to access quality and affordable health services as the government implements the newly launched UHC plan. Elizabeth Atieno, TV 47.